That is the story of America and the pandemic. And we are writing another dark chapter right now. All 50 states and Washington, D.C., all of us are reporting rises in new COVID cases from a week ago. It's the first time that's happened since January. All 50 of us. 38 of them are seeing at least a 50% increase. Hospitalizations way up. Deaths up. Why? Two reasons. One, the obvious. We're out. We're in contact. We knew this would happen. It's the second one that we have to focus on. It's the real problem. The hope was the vaccine would even the stakes. But once again, America is making her sick by not taking it. And too often for bad reason. Proof. Case rates are highest in which states? Those with the lower vaccination rates. A pandemic of the unvaccinated, according to the CDC. And which states are those? Red ones, mostly. The Delta variant, overall hitting red states hardest. That's where the majority of the vaccine hesitant reside. Among them, Florida. White House says 1 in 5 cases came from Florida this week, 20%. What's the governor there doing? DeSantis is hawking, "Don't Fauci my Florida" merchandise. Beer cozies, t-shirts. Why? COVIDiocy. He's banking on people going bad, on being told what to do, on listening to these people. They don't like Trump. DeSantis got vaccinated early on. So did Trump and his family. Developing the vaccine in record time was Trump's signature contribution to the pandemic, the fruit of Operation Warp Speed. So why aren't he and his followers pushing it among the faithful? Take a listen.
We are delivering millions of doses of a safe and effective vaccine that will soon end this terrible pandemic and save millions and millions of lives. It is truly a Christmas miracle.
So why isn't he getting you to buy and use and take? It's free, this Christmas miracle. Now, this is his response to push it.
They all want me to do a commercial because a lot of our people don't want to take vaccine. You know, I don't know what that is exactly. Republican, I don't know what it is.
You don't know what it is? Just like you didn't know who David Duke was? Or any of the bad actors who back you? Mr. Trump has selective amnesia when it comes to knowing about what he doesn't think works for him. The question is, why does Trump think the vaccine is not in his interest when he created it? Maybe it is because he's not getting the credit for any progress now because it's not on his watch. So there's nothing in it for him. And he is better served by division. Maybe that's why he's okay with letting his people badmouth his signature achievement with deadly disinformation. A lot of maybes. Here's proof of them.
The government was hoping that they could sort of sucker 90% of the population into getting vaccinated, and it isn't happening, right? There's a younger people
who applauds not getting vaccinated. People who have been misled that it is good for them not to take it. This past weekend, when a speaker noted the Biden White House hasn't reached its vaccination goal yet, what do you see? What do you see? You see Trump is happy about it. My team did a rough count from 6 of his public appearances since the election. You mentioned the election? Around 221 times. Vaccine? About 39. And not, forget about just the numbers. It's the quality. In those 39, overwhelmingly, he just said, I did it, I did it, I did it. But he didn't push taking it. Now, what does that tell you? Trump seems to have it both ways. Takes credit for making it and takes advantage from the division that is keeping his people from taking it. More and more people are going the wrong way because they are unprotected after buying into the BS. So President Biden today specifically took aim at social media companies like Facebook for not doing enough to spread the anti-vaxxer BS. Listen.
They're killing people. The only pandemic we have is among the unvaccinated. And they're killing people.
It's a hefty charge. Let's take it to the better minds. Smirkanish and Dr. Lena Wen, author of a new book coming out Lifelines, a doctor's journey in the fight for public health. Good to have you both. Smirk, help me. He creates the vaccine. He said, look, Operation Warp Speed was great. Now he doesn't want anybody to take it. They asked him to do a commercial. He said, what? Who's a Republican? What? Why?
He's sacrificing one of the best arguments that he has, because by your own statistics and anecdotally, I can bear that out because I've watched most of those appearances. He really doesn't assert himself and take full credit to the extent you would expect. Why is that the case? I think to the extent there's any strategy involved here, and I don't know if there is, he's always been about motivation and not persuasion. He's always been about doing what it takes to motivate the hardcore to get out there and be supportive, rather than to try and get people to meet him halfway and win hearts and minds. So in this case, I think he believes he would appear soft in front of some of those fringe types that he wants to keep inside the tent. So he's willing to forego mention of Operation Warp Speed so as to keep them happy and stay out of the fray. One other thing, Chris, ask yourself this. Even if he were to do the PSA, even if he were to implore his followers to get vaccinated, would they necessarily follow? I have my doubts.
You know, he said go down to the Capitol and make sure they know that we're here. They sure as hell followed up on that request, Smirk. So taking a vaccine is a lot easier than attacking the Capitol. Dr. Lena Wen, here's the problem. Americans' confidence in major U.S. institutions, like the medical system, declined. We have a full screen for it. 2019, 2020, 2021. You take a look at it, confidence in the medical system, 36% 2019, 51% June 2020, now coming back down again June 2021. So that's a battle within the battle, right?
Yeah, I mean, we're facing misinformation and disinformation on a lot of fronts. But just to follow up on what Michael was just saying, I mean, I think that he's right. I mean, former President Trump had plenty of opportunity to convince his followers earlier. And what I'm concerned about is that there is this narrative out there. The most common reason I'd say that I hear from people about why they're not vaccinated is they think that there's more to fear from the vaccine than there is from the virus, which obviously is totally backwards. I mean, this is a deadly virus. The vaccine is what saves your life. And I would hope that the information from doctors will make a difference, politicians will make a difference. I hope so. But I actually think it's a bit too late for that. I think we need to take a lot more dramatic action in the form of proof of vaccination and ultimately vaccine mandates.
Quick bounce question to you, Dr. Wen. 49% of people in a recent poll who haven't taken the vaccine said it being FDA approved would help them with that. My man D. Lemon went bad on me on that argument last night. He's like, oh, they don't understand. It's about efficacy, not approval. I said, yeah, but anything that is approval must have efficacy. And he goes, oh, no, it can have efficacy and not be approved. I said, I know, but if it is approved, it must have efficacy, and that gives people comfort. Do you agree?
I do. I think that full approval will make a huge difference for two reasons. One is that there are some people who call this vaccine experimental. Obviously, it's not experimental. It's been given to hundreds of millions of people. It's just fine. It should be, frankly, approved at this point. But having full approval would take that argument and that arrow out of the quiver. The second reason is there are lots of workplaces and schools that have not gone the route of vaccine mandates because they just aren't sure that they can without full approval. So that will also allow for a lot more people to be vaccinated who are on the fence right now. They don't know, they're not really opposed to getting the vaccine, but they need that extra push, and that kind of mandate and full approval would do the trick.
Looking at DeSantis down in Florida, he's a smart guy. He got vaccinated. He was doing the vaccinated thing heavy on early on. Now, he's going bad on it. Is there advantage in playing up this don't get vaccinated movement in terms of it being anti-institution? Don't let Big Brother tell you what to do. The left is sneaky. Fauci looks sneaky. Do you think that there is advantage for that on the right?
I do. If you're asking me, I think that there is, and the data that I would point to is you were talking about those areas of the country where vaccination lags behind the national average. Chris, if you did sort of an overlay of the 2020 election results and the vaccination rate, you'd see a hell of a lot of similarity. So it would help, I would think, DeSantis to be the don't tread on me guy in primary season, Whether he could sell that to suburbanites and win a general election nationwide, that remains to be seen.
So we're seeing the cases come up, Dr. Wen. And we expected this. You and I have talked about this a lot. Once you get rid of the restrictions and the masks come off, we see how many people getting sinus infections and good old stomach viruses again, right? We hadn't seen those for a year or so. We expected that. The hedge was the vaccine will take up the slack and help people not get that sick. It's not happening. And now you're seeing the cases come up. What's your concern for fall?
Well, I was hoping that we could get through the summer. My prediction was that we would have a good summer and then we would see cases potentially surge again in the fall. It's already gotten bad and we're only in the middle of July. And I have to go back to what you and I talked about a while ago, Chris, which is that the CDC really made a big mistake here by saying that fully vaccinated people can take off their masks, but not having any way to verify this and just say that we need to trust the honor system. People are not behaving honorably. The unvaccinated are basically saying, well, it's open season for me. I can do whatever I want as well. And as a result, we did not incentivize people to get vaccinated. It was exactly the opposite. These restrictions got removed. People are doing whatever they want to. And unfortunately, we are seeing surges as a result. Now it's going to be really hard to put the genie back in the bottle. And that's what I'm afraid of. These states that have really low vaccination rates, they need indoor masking mandates now. But that's not going to happen. And so we're going to get more preventable deaths.
It's not as easy, Mike, to argue to mandate something that's not FDA approved. That is an issue. Private businesses can do it. States could do it. I just don't think they have leverage. What do you think happens if the cases go really high and people start suggesting at the federal level that you may want to think about significant measures again? You're seeing them in California. Do you think people will go for it?
I'm a little disappointed that I walk around with my wallet possessing a vaccination card, proof of vaccination. I've never had to show it. And I'm leading a pretty active life, and including, flying several times in the last few weeks. Like Dr. Wen, I'm a bit disappointed. I mean, look, you know the rules at CNN. You know the coming back to work standard that's been set. I have the same thing at the law firm where I'm associated, Chris. I like it. I like the fact that you have employers and private industry saying, without regard to a religious exception or a medical condition, our expectation is you're going to be vaccinated. Can I give you the statistic of the week? The statistic of the week is that every patient hospitalized in Los Angeles County this week for COVID, unvaccinated. Or said differently, no vaccinated patient was hospitalized in all of Los Angeles County this week for a COVID-related ailment. That's the kind of message that needs to be sent, I think, to the unvaccinated. You're taking a hell of a risk.
Yeah, I was talking to somebody on the radio today, and I said, ask yourself, how much can somebody care about you if they encourage you to not get vaccinated? Just think about it. Just think about what that says about that person and whether or not they care about you. Michael Smirkanish, Dr. Lena Wen, thank you both. Have good weekends.